and welcome to AgeWise Health. I'm your host today, Madelyn Dedaj, and today with us on our show we have Jamian, President and CEO of AmeriCare Medical. Hi, Greg. Welcome to the show.
Hi, Madelyn. Thanks for having me.
Of course. Today we're going to be talking about the common pitfalls of choosing a Medicare Advantage plan over a traditional Medicare plan when you turn 65. Greg, can you tell us a little bit about yourself and your background in healthcare?
Sure. I started in the insurance business probably after I graduated from college, Oakland University, the Harvard of the Midwest. Okay. In fact, while we're on the subject, they have the best nurses coming out of that school.
Yes.
That university. And I do sit on the board of directors for the nursing school, and it's a phenomenal school. But upon graduating with a degree in economics, I went into the insurance business and was an underwriter for, back in the day they called it hospitalization insurance, basically health insurance, and did that for a number of years. And that's kind of where I learned the insurance piece that has supported me in my career for the last 45 years. But I then, after 12 years in that, I started a company in the home care space, and now it's one of the largest companies in Michigan, home health care companies, I'm proud to say. And we offer nursing services, home nursing services, Medicare, physical therapy in the home, as well as private duty, pharmacy, and durable medical equipment. Is another product line of ours. So I've had a great career in that. Learn every day. I'm still learning. I'm still very active in the business.
Yeah, absolutely. It's great.
Thank you for asking.
Yeah, it sounds like you have quite an extensive background in healthcare. So today we want to talk a little bit about Medicare plans and Medicare Advantage versus traditional Medicare. So can you explain the difference between the plan choices available under Medicare?
Sure. Based on my experience and servicing thousands of patients, helping thousands of patients over the years, you hear patient concerns. So you start learning the differences between certain types of coverage and the problems and issues that patients have with different programs. So Medicare has two major options out there. One is the traditional red, white, and blue card that most people have. And then the other is they have an option to buy what's called a Medicare Advantage plan. And these are offered by, various companies, and we can go into that in a minute. And they're highly marketed plans, which, in my opinion, are not as good or effective in meeting all the needs of the patients. But the traditional so basically the way it works is these Medicare Part C programs called Advantage programs, they kind of buy your existing coverage from traditional Medicare, and then they repackage it, and they're very smart. They take your coverage, now they're your provider. They provide you with less benefits, major benefits, meaningful benefits. Mm-hmm. And then with the savings that they receive from that, they put, they have the profits. And so it's a very lucrative type of product offering for insurance companies to offer this Medicare Advantage program. And, a lot of hospitals and physicians' offices are now not accepting patients with those kinds of coverages.
Oh, wow. Okay. So what percent of seniors do you think are choosing Medicare Advantage plans?
Well, several years ago, it was around 43% had the Medicare, were selecting Medicare Advantage. And I just read recently that it's close to 50% now.
Oh, so it's increased.
Yeah, the marketing, Madelyn, the marketing dollars are incredible. I mean, during enrollment periods, if you're watching television or listening to the radio, not a minute goes by without hearing somebody hawking, the benefits of a Medicare Advantage plan. And of course, there's high commissions involved and high profits involved for these insurance companies to get you to switch from traditional Medicare, red, white, and blue, to these lesser programs. They offer things like free gym membership. Well, you can go pretty much anywhere and get a membership at a gym for $8 a month. But but should you ever need to be in a rehab facility or a hospital for an extensive period of time, they fall short in providing the benefits for that. So the stuff that costs, the care that costs a lot of money, they fall short on. But the stuff that doesn't cost anything, they're big. For example, I heard someone saying the other day that, there's no deductible evacuation if you're in a foreign country under this Medicare Advantage plan.
Wow.
Yeah, if you have a health condition.
Right.
But what percent of the population that's, 65, 70 or older, needs to be evacuated from a foreign country? So they sell the sizzle at the cost of the actual steak.
Right. So is that what you would say is probably driving the growth of more people choosing this plan? Is the intense marketing that's going behind it?
Intense marketing, it's very profitable for the commercial insurance companies to sell, high commissions. And then, quite frankly, a lot of seniors are, penny wise but pound foolish, and they're not made aware up front of the meaningful shortfalls that these plans offer. So those are some of the things. And,
yeah.
When you throw the kind of dollars that they're throwing in marketing and advertising, it's hard. It's a strong sell, and it's hard for a senior who's on a fixed budget to say, no to it.
Right, absolutely. So I know you touched on this a little bit already, but what makes these plans so appealing to seniors? Why are they choosing them?
So a lot of these plans, again, offer less, meaningful, but it sounds great, benefits. For example, a lot of dazzle, okay? Free hearing tests. And it sounds great because traditional Medicare doesn't offer free hearing tests, but yet you can go to any kind of health fair and get a hearing test for free. So, is that really a meaningful benefit? To many, it may be. I think everybody should, have hearing tests, when they hit a certain age. But, this is some of the things that the dazzle that they're creating. The free gym memberships. They also, some programs under Medicare, dental is not included. So these plans, light up these seniors' interest by saying, free dental care. Well, when you drill down into it, it's one dental cleaning once a year. So, but again, you're taking those upfront little benefits at the cost of, God forbid, if you really need, extensive health care later on in the year or later on in your life.
Right, and that's a big difference. So are these plans a good fit for everybody, or are there certain people that you think would be more benefited by them than others?
Well, again, I have to repeat, some upfront savings, appealing to some that are on a fixed income, but at the expense of possibly expensive care at a later date. So you kind of got to weigh the two, but you really don't know what's in store for the future. And yeah, preventative items, can help you stay healthier and so forth. But so those are some of the things that people should consider. Do they want the little things today up front, or do they want to be prepared for something catastrophic at a later date? And we don't know what we're going to be faced with. Maybe it's heart surgery. Maybe it's going in for a catheterization. Maybe it's a stroke. There was a story in the Wall Street Journal a couple weeks ago about a woman who had a stroke, and she was enrolled in a Medicare Advantage plan. So after 14 days in a rehab that treated her for the stroke, they said, your days have run out, 14 days. Now under Medicare, you have 100 days. And the family said, she doesn't have any place to go. She's improving every day, but she's not ready to go home yet. They said, we're sorry, you have 14 days, and so you're being discharged. And so there was a way for them to disenroll from the Medicare Advantage program and enroll in a traditional Medicare plan kind of fairly quickly. And it was estimated and calculated that that extra cost was $68,000, but she got the care that she needed under the traditional Medicare plan.
Right, and that's what's always most important at the end of the day.
So the Medicare Advantage plan, conceivably saved $68,000, by kicking her out, after 14 days.
Right.
Now there is an appeal process that you can go through, but most people lose the appeals. Okay, very rarely can you. If you look at the appeal rate, success of the appeals, very small.
Right. Okay. So, who are some of the key players in the Medicare market?
Well, one of probably the largest is United Health, and there's Humana and CVS, Aetna, because now they've combined, and Cigna Group, Kaiser. These are Permanente. These are some of the large companies that are behind the Advantage programs. And of course, locally here in Michigan, we have HAP and Blue Cross and Priority Health. But recently reported in Crain's Magazine, Trinity Health has now stopped accepting insureds, patients, seniors that have Humana Medicare Advantage plans. 28,000 seniors in Michigan have it.
Wow.
And now they cannot go to a Trinity Health hospital.
Wow.
It's crazy because hospitals are saying enough is enough. We can no longer treat these patients or bring, house them and lose money on every day they're here. So, hospitals and insurance companies are saying enough is enough.
Right. So, these Medicare Advantage plans that we've been talking about here, how do these plans offer extra benefits that someone might think, well, traditional Medicare doesn't offer that?
Well, when you're collecting somebody's premium and you have a common practice of delay, deny, and defend. This is on the insurance company side. And it's been in the news lately. We've heard all about it. And there was a Denzel Washington movie about it where his son was in an HMO and couldn't get the care he needed to be healed. So delay, deny, and defend is the typical strategy of these insurance companies to limit and reduce the access to your care, to decrease utilization, because the more they decrease utilization, the more money they make.
Right.
So, when you're restricting care to seniors, these insurance companies are saving a lot of money. And so that's one way that sometimes they can throw in these small extra benefits. Limiting formularies is another. Restrictive provider networks telling you, no, you cannot no longer go to your doctor, or you can no longer go to the hospital that's at the corner or down the street or maybe in a different state that specializes in the care you need.
Right.
So this is how they save money, and this is how they can give you some of the small items up front and dazzle you with it, but really you're giving up a lot.
Yeah, absolutely. So tell me a little bit about prior approvals. What are they and how do those work?
Well, there's a lot of information on that right now, and basically they're tools, in my opinion, to deny care. decrease utilization. A lot of AI is being used in the process, and algorithms. Insurance companies are really smart at creating these algorithms, which ones produce the best financial outcome, not clinical outcome, but financial outcome. And so using these tools in prior authorization determinations help, drive down the insurance company's costs and, of course, drive down the quality of the health care that Americans are getting, receiving.
Right. So it sounds like there's a lot that goes into this, and it seems like seniors need to be a little bit more careful when deciding if they want to switch from their traditional Medicare plans. Is there anywhere else that they can go to learn more information about this?
Of course. Do not just Google Medicare plans, because you'll be infiltrated with a lot of Medicare Advantage advertising and marketing dollars. Just go right to the government, Medicare.gov or 1-800-Medicare. And I've gone to those sites many times, the government sites, the Medicare sites, and they're great. They're very informative.
Great. All right. Thank you, Greg. This has been very informative. I appreciate you joining us today and sharing your insight.
Happy to be here. Thank you.
Absolutely. Thank you for joining us today on AgeWise Health. If you have any questions about today's show, please give us a call at 248-288-2270. And as always, stay safe and healthy.